There you
Okay,
go.
and we're live. Amazing. Okay. Well, thank you so much to everyone who is tuning in live today or watching the recording. We are so excited for today's episode of the MYOS MD Power Panel. Before we get started, I want to mention that our Power Panel is sponsored by MYOS MD. MYOS MD is a cutting-edge nutritional supplement designed to combat muscle loss and support healthier aging. It's powered by Fortetropin, which is a natural bioactive compound clinically shown to enhance muscle growth and reduce anabolic resistance. So MYOS MD is really changing the way we think about muscle health. If you'd like to learn more, please visit myosmd.com. All right, so into today's episode, we have Dr. Elizabeth Yurth, and so would love to get started, hear a little bit about your career. It spanned everything from regenerative medicine to orthopedics to the science of longevity. So if you could tell us a little bit about you and how muscle health and metabolism play a role in aging.
Sure. Well, first of all, I really got my start in orthopedics. So, muscles were always kind of paramount to my life, just from, which is why I kind of geared into orthopedics, aside from having a lot of orthopedic injuries myself. So, and I really practiced orthopedics for about 30 years. And I actually got a little more and more frustrated over time with really people not healing, I felt like I patched people together, but they were really getting better. So I got a lot more interested in more health-focused medicine. So regenerative medicine, hormone medicine, nutrients, how can we actually get people healthier? And that sprouted about 18 years ago, the opening of Boulder Longevity Institute, which I sort of kept separate from my orthopedic practice. I was in orthopedic practice, and at night I'd wear a different hat. I'd come over to my regenerative medicine clinic where we'd sort of, in my mind, actually make people better. So in orthopedics, I felt like I kind of patched people up for them to fall apart again. And then at the regenerative clinic, at Boulder Longevity Institute, we could actually make people healthy. So now the two clinics kind of merged. We do a lot of regenerative orthopedics, not a lot of surgical orthopedics anymore, but regenerative orthopedics, things like stem cells and exosomes and platelets and alpha-2 macroglobulin, all sorts of things. And we do a lot of just health-focused medicine, working with hormones and peptides. So my background now, I teach a lot of peptide therapies. We use a lot of nutritional components. We use a lot of hormonal compounds to just get people healthy. And we work with a lot of high-level athletes, as well as sick people who were trying to get better, or injured people who were trying to get healthy. So, that's kind of what brought me into this whole world of muscle health and metabolism, because it's such a key part of overall health. In fact, maybe one of the main players to overall health.
Yes, definitely. Thank you so much for the background. We'll be diving into a lot of the topics that you briefly mentioned. So to start, though, with muscle health. So it's often overlooked when we talk about longevity. I would say in the last maybe decade or even 5 years, more people are starting to talk about the link and the really, pivotal importance of muscle health in longevity. But really, why is it so essential for maintaining overall health as we age?
I think, honestly, it's really not until relatively recently that we always thought about skeletal muscles' mechanical function, right? To support our bones, to let us move, to let us do things. And we really forgot that it's actually your largest endocrine organ. So just like your heart or your brain, it's an endocrine organ, and actually a very important one. So it actually produces these vital myokines, and now what we know are called exokines. So there's cytokines that are produced by your muscles, like interleukin-6 and interleukin-16 and irisin. And then there's exokines, and when you do specific exercises, that are different cytokines that are released when we do muscle contraction. So these muscle-derived signals actually have these far-reaching powers, right? To reduce inflammation, to help cellular regeneration, to help your bones get healthy and strong. So if we lose muscle, it'd be a little bit like saying, oh, I don't care if my heart gets smaller as I age or my brain gets smaller as I age, right? Muscle should not get smaller as we age, because it is a key endocrine player to all these other factors that are helping with the aging process. Remember, one of the things that muscles produces is brain-derived neurotrophic factor. So it's also important for brain. So it's not really an organ in your body that is not affected by your muscle mass. And so if we can really think of it more as that's our currency for health, I think we're gonna have a little different perspective than, okay, I just want to look good, or I want to, I want to be able to pick up my kids or whatever, things like that. You have to actually start thinking about this as an endocrine organ. So I think that's where the shift has kind of come, and why muscle maintenance has taken such a critical front role in health. is because it is absolutely critical for your metabolism, for your immune function, for your brain health, for your bone density, for your heart function. And that's because of these cytokines that are actually produced by muscle.
Yeah, that makes sense. And, as we age, let's say for patients that are over 40, what are some of the biggest metabolic shifts that you see, and how do you address them in clinic?
Well, that's huge. And I will say this, I think we're starting to see this happen even younger than 40. But the biggest metabolic shift, obviously, that happens as we age, and we're talking, maybe mid-30s, is we start getting hormonal changes, right? So think about hormones and their impact on muscle metabolism. Because if muscle metabolism is central to health, if I don't have the hormones to support muscle, then I'm in the perfect storm scenario. So we get a decline in our anabolic hormones, both men and women. Testosterone starts to reduce really relatively young. I mean, we're seeing guys now in their 30s with low testosterone. Women start reducing their testosterone in their 20s. Growth hormone starts to reduce. So that's going to markedly impair muscle protein synthesis. So if I don't have testosterone, I don't have adequate growth hormone, and I'm trying to exercise, I can't really put on muscle. And we have estrogen changes in women at that perimenopause and menopause period. And that's going to markedly affect insulin sensitivity, which is also going to affect muscle. And then thyroid starts to decline as we age. And thyroid is going to affect basal metabolic rate, which is important to muscle mass. So that reduction in these hormonal shifts that occurs as we age is going to reduce your ability to build muscle. If I can't build muscle, I don't have the capacity to produce these vital myokines and exokines, right? So if we don't have this anabolic response to exercise and protein intake, then all of these other things are going to be affected. And I can't expect somebody to put on muscle if they don't have the baseline things necessary, like hormones, to do it.
Yes, and I'd love to dive a little bit deeper into, hormones and how hormone imbalances play a significant role in metabolic health. If you could talk a little bit more about that. Like, what are some of the most overlooked hormone-related factors as they pertain to longevity?
Well, I think that number one, I think that we are neglecting to look at things like testosterone. You'll have, younger men even now who are complaining of anxiety or depression. And lots of times those are signs of low testosterone. COVID did a number of testosterone. So people who had COVID, lots of times we saw a big decline in hormone levels. And so we need to, number one, have an awareness to look at these things. And then in women, it gets completely neglected, right? It's sort of like, well, women don't need testosterone. And that's so untrue because testosterone is so critical to muscle mass that to ignore it in women is doing them a huge disservice, especially to things like brain. And we know that cognitive impairment is more common in women than men. And so basically, if we can maintain muscle, are we going to be able to maintain brain better? So I think number one, I would say there's this awareness to these hormones declining even at young ages in people, and start following and checking these things young. And so I think number one, we're neglecting to check them at an early enough stage, and then we're neglecting the necessity of having optimal levels of these hormones, not normal levels, but optimal levels. And so as as physicians, you guys need to be checking hormone levels even on your younger patients when they have complaints, especially in your women. If you have a female on birth control pills, for instance, remember birth control pills markedly raise sex hormone binding globulin. So if I have a young female on birth control pills, she has bound all of her testosterone. She has no free testosterone available. So now she's going to have the downsides of that low testosterone, which can go on even years after stopping birth control pills. So you guys, as practitioners, need to really have an awareness for checking these hormones in people and looking at them and looking at all three: estrogen, progesterone, and testosterone, all critical to muscle building and to the rest of health. And you have to look at all three of them in both sexes.
Yeah, I fully agree. And not to fully, shift gears, but on the topic of hormones, I would love to talk about, one that's very popular right now, the one making headlines. So GLP-1 and the medications like, semaglutide, Ozempic, Wegovy, and, the associated muscle loss with long-term use, or even honestly, short-term use of GLP-1 medications. So how do you safely incorporate GLP-1s into patient care with, the thought process of like, okay, if a patient is taking this, it is the right fit for them, but how do we preserve the muscle mass?
So number one, that's a complete and utter misconception that GLP medications directly cause muscle loss. They do not. So please, we need to get rid of that misconception. I know it's gotten, thrown by the press, but the perceived muscle loss that you see in patients on GLP-1s is due to inadequate protein intake. So it's not that the GLP-1s are hurting muscle, is that people are not eating enough protein to sustain muscle. So it's really paramount to tell your patients on GLP-1s they've got it because they don't have an appetite. They have to prioritize protein. And if they cannot get enough protein in, meaning in my mind, 1 gram per pound of lean body mass, then you need to tell them this is not going to work for you because you're going to lose muscle. But if you think about when GLP-1s first came out, for diabetics, they actually were used to support muscle health because used appropriately, they enhance insulin sensitivity. They produce improved glucose uptake into muscles. So it's exactly what you want to see, improved insulin sensitivity, glucose being taken up by muscles. And so this improved glucose handling is going to support muscle energy metabolism. And so they're actually going to help lean muscle mass and to lose fat but gain lean muscle mass. So it's a completely press derived, media derived, bastardizing GLP-1s when ultimately it's really poor oversight of whoever's prescribing those GLP-1s to encourage that their patients are taking in adequate protein. And we monitor that very closely. So while my patients are on GLP-1s, I want them to be going for a gram per pound of lean body mass. So what is their goal weight? What is their lean body mass? A gram of protein for each pound. And then prioritizing protein at meals because your appetite is reduced. You've got to say the first thing I'm going to eat is my protein. And that might be utilizing protein shakes, things like that. And then also making sure that protein is timed appropriately, right? So timed around exercise, because that's going to be the most utilizable time of that protein. So, track the protein intake, keep them maintaining resistance training. Okay. And then, just ensuring that they are getting enough nutrition. But please get out of your mind that misconception that GLP-1s, they actually were used early on to help diabetics put on muscle, not vice versa. So in my mind, it's just a non-negotiable thing when I have patients on GLP-1s, and I use them a lot because they're not just great drugs for weight loss. They're great drugs for metabolic health. They're great drugs for brain health. They're great drugs for cardiac health. So these are incredible drugs, but they have to be used appropriately. They can't be misused. They can't be dosed inappropriately high. You have to use them appropriately, and you have to be monitoring your patients that they're taking in enough protein while they're on them.
Yeah, I absolutely agree. And, what if a practitioner asks you, so I have patients that are not on GLP-1s, I think especially in the headlines now on social media, everyone's talking about the importance of protein. And I would love to hear your perspective. How do you guide patients on protein consumption, maybe if they're not on GLP-1s?
So protein is so huge. I think that we have to, number one, people sort of assume we need less protein as we age. We actually need more protein as we age. So that's I think something, people start eating less and less protein. Like you're this young bodybuilder, look at my, 20-year-old kids, and, they're eating tons and tons of protein, and they're, and then you look at the 70-year-old women or 60-year-old women, and they're eating no protein. And that's a misconception. That 60-year-old woman needs more protein, honestly, than the 20-year-old guy because they're less efficient at utilizing the protein. So at least 1 gram per pound of lean body mass is essential. That's a minimum, not a maximum. That is a minimum. So if you really are trying to put on a lot of muscle, you've got to even go up from there. And it's not easy. I can tell you, I'm skinny. I weigh 130 pounds, but I try and eat 130 grams of protein a day, and it is not easy. So number one, people so underestimate their needs. You ask people when people say, "Oh, I'm eating a lot of protein," I have them track it. They're maybe getting 50, 60 grams. They're not anywhere close to 120 grams that they may need. So, especially with age, or if you're doing more anabolic resistance, which everybody should be doing, then that might go up to even 1.2, 1.5 grams per pound of lean body mass, right? So we really, honestly, the data shows that as we age, we need 35 to 40% more protein than younger adults do. And look what happens. We eat less, right? We're dieting more, we're eating less. So we've got to really, really push that narrative that as we age, we need more protein. Over the age of 60, you actually may need double the protein of young adults. So you're talking about, acute protein doses of 40 grams per meal, often necessary. You may have to use 4 to 6 feedings. Each meal should have 30, 40 grams of a good high quality protein. It's critical to use that pre and that post exercise window. So within about 2 hours after exercise, we know that protein is really utilizable for muscle. And then, that breakfast protein, I know a lot of people now are skipping breakfast. And I know there is this whole intermittent fasting and going longer time without eating. There's some benefits to that, when you look at intermittent fasting's effects on health, but at the detriment of protein intake a lot of times. So if you're skipping breakfast and you're not eating, or the OMAD diet, the 1 meal a day diet, is very hard to cram 130 grams of protein into one meal, right? So when you look at these intermittent fasting or 1 meal a day diets, I think those should be used on and off and not continuously, because for the most part, I would like my patients to eat a good, 3 eggs for breakfast. Eggs are full of choline, they're superfoods. So I'd like them to really get a good protein source in. And in my elderly people who don't want to eat, who don't have great appetites, that's where you're going to have to maybe use things like some good, healthy quality whey protein shakes or things like that.
I was actually going to ask about that next. So what are some of your favorite sources of high quality protein? You mentioned eggs, for, patients who maybe have a lower appetite, thinking about shakes, but what else is on your short list?
Honestly, and to all you people, and I'll tell you, I was a vegetarian for years, but it's not a healthy diet. You really need meat-based proteins are the best, and especially choline. Choline needs to come from meat-based to really be utilizable from your brain. So when we look at choline taken in the supplements that's not meat-based, like sunflower lecithin, the choline, things like that, they're not nearly as good for your brain. So you need meat-based choline. So honestly, I love people to eat eggs. I love people to eat organ meats. And, I know a lot of people don't like to eat organ meats, but, there's some companies that make like a ground beef with organ meats ground into it that you can't taste the organ meats in. So I love those as sources of protein. I think that if you are not a meat eater, then and if you're vegan, this is different, but I think really a whey protein is a very complete protein source. Pea proteins and hemp proteins are okay. They're not as complete. So, in my mind, if you are a vegan, it's very hard to meet the stores that you actually need, but you do the best you can. And so I would say, yes, hemp protein, pea proteins are okay, even though they're not as complete. Whey protein is still the best, and there's so many, good whey proteins. So I would really encourage, and I get moral, ethical reasons that you might want to be a vegan, but for health reasons, it's very hard to get my vegans very healthy, honestly, because you so need these very high quality proteins, and most of those do come from meat. And like I said, I'm talking to somebody who I wouldn't kill an animal for, many years of my life. I was like, okay. And then as my health started to fail, I was like, okay, I need to add some protein in, or higher or better quality protein in.
Yeah, I too was vegan for over 7 years. And as I started learning more about health, longevity, shifting to integrative medicine, I decided to make the shift myself. And
it's hard, right? It's hard, and I don't find the taste of meat particularly I'm not wonderful, but I think my health improves so much, and my ability to put on muscle improves so much when I started eating more animal-based proteins.
Great. Yeah. And I wanted to ask you, so in your clinic, how have you incorporated MYOS MD? As I mentioned earlier, we are sponsored by MYOS MD. It's a clinically studied ingredient that supports muscle health and reduces myostatin levels. So how do you use it in your clinical practice?
So I love MYOS. I don't know how many of you guys have tried MYOS, but it's kind of amazing. I just add it to my protein shake in the morning because now I'm getting this myostatin inhibitor, right? So it's basically, all you guys who are into your follistatin gene therapy, you can do it yourself with using something like MYOS MD, which, remember, is blocking this myostatin, acting like a follistatin. And so that's what the Fortetropin is sort of acts like the follistatin. And so I love this because I could use it after my workouts in my protein shake, and I will tell you, it is really great for putting on muscle. So my clinic is a wonderful go-to in my people who I'm really trying to help with sarcopenia. For instance, I just saw a patient this morning who, had elderly, 72, actually a little older, 75, and she fell, and she has this horrible sacroiliac pain, sacroiliac injury, and she's not healing. And part of the reason is she does not eat. And so what I can do with her at least is encourage a protein shake, add the MYOS MD in, right? So now I'm actually helping her to put back on some muscle without having to, to try markedly increase her appetite, which I'm not going to do very easily because this is not something that's, so I get this instant nice way to feed muscle without having to throw a whole bunch of calories and a whole bunch of trying to get, massive amounts of nutrition to this lady. So I love to use it post injuries in my patients. We also use it a lot post surgeries on people, because remember, it's you will rapidly post surgery, if you have an injury, start to lose muscle. So if I can encourage that blocking of myostatin, I can encourage muscle mass to stay around by using this product. So we use it, or if we do regenerative procedures on people where we really want this healing capacity, it's a great time to utilize this. But by far the biggest group I love it in, aside from, my bodybuilders really like it. It made it into the bodybuilding world long before it ever made it into the medical world. I always lecture at Mr. Olympia, and the bodybuilders have been using a MYOS like product forever, and so now it's finally made into the medical world, which is great because it's not just bodybuilders who need muscle. As I just said, all of us need muscle. If I have a product now that's really simple to use, I can put muscle on my patients. And it is one of the things I preach: resistance training and muscle. So I have people resistance train, do the MYOS MD after the resistance training, and they're gonna see results. They're gonna see more muscle mass put on, and that's gonna be utilizable for every other thing I want to do. But I love it in my practice for my elderly people who I can't really get a whole lot of food into, because I've got to get muscle onto them. I absolutely have to. So this is a little bit of a cheater way of doing it.
Great. Yeah, thank you. And you mentioned regenerative medicine. I know peptides is something you educate a lot of healthcare providers on, a lot of patients on. So can you share a little bit about peptides and how you use them to support muscle health and metabolism, particularly in patients who are aging?
Yeah. So remember, one of the things I mentioned declines as we age is growth hormone. No matter what you do, your growth hormones are going to drop as we age. But growth hormone is really critical, not just to muscle, as we always thought about in the bodybuilder world, as critical to muscle, but it's critical to every single tissue. There are growth hormone receptors, or IGF receptors. Remember, your pituitary secretes growth hormone, which tells your liver to produce insulin-like growth factor. IGF receptors are on your immune cells. They're in your brain. They're on your gut. So really, when you see a decline in growth hormone, which will equate to a decline in IGF levels, then you're going to start seeing health fail. And that's going to happen even if you're exercising. Exercise helps. Even if you're doing all the right things, that's just going to decline with age. So if we can do things that help support growth hormone secretion, then we can really support muscle, we can support brain, we can support immune health. So I love growth hormone secretagogues. Now, why don't we use growth hormone as much? Well, if you think about growth hormone, if you think about it, it is much more difficult to use and much less physiologic. So if I give somebody, remember the old bodybuilders who had those like turtle bellies? That was because they took a lot of growth hormone, and growth hormone caused organomegaly. It caused their spleen and their livers to grow, and they would get this weird turtle-y looking belly, and that actually sustains even after you stop the growth hormone. But what you can do with secretagogues, and these are things like CJC. CJC is it's called a growth hormone releasing hormone. Ipamorelin is a growth hormone releasing peptide. You can use those together, and what they do is they naturally tell your own pituitary to make and release more growth hormone. So now I'm getting very physiologic levels of growth hormone. They're going to kind of wax and wane, just like my own growth hormones do. It's not going to be super physiologic levels. So it's going to support muscle protein synthesis, really enhance recovery and repair. If you do it before you sleep at night, you're going to get a lot more recovery and repair. So you're going to be less sore, you're going to be more able to work out the next day. It's going to improve metabolic flexibility, fat utilization. So growth hormone secretagogues, I think, very top of your list when you're thinking about things to try and maintain muscle mass, particularly. And again, there's a lot of options out there. Most commonly, we use CJC and Ipamorelin, but Tesamorelin is actually an FDA-approved growth hormone secretagogue. So, that's one that it's an FDA-approved drug. We can get it compounded as well. And then I love, if you think about other endogenous peptides, meaning peptides that our body makes itself that decline as we age, it's going to be things like body protective compound 157 or BPC 157, which many of you guys have heard about. BPC is made by our gut. So it's actually a gastric peptide that is made by our gut in response to things like injury. And then it pans out and it helps tissue healing and muscle repair, collagen synthesis. So that's going to improve recovery from exercise, help the muscle tendon junction integrity. So that's another great peptide utilized in the muscle building world or in the recovery mode world. And then the thymic peptides. So the other thing that declines. So I'm a big fan of, let's replace what we lose. We lose hormones, we lose growth hormone, we lose all our sex hormones, and we lose some of these peptides. One of which is body protective compound. Two of these are thymic peptides. So remember, our thymus gland, by the time we hit puberty, starts to shrink. By the time you're old like me, it is a little tiny nub that's doing nothing. And so basically, if I can give back the peptides that my thymus gland made, and one of those is thymosin beta 4, kind of known out in the world sometimes as TB500, but that's not a real name. It's really thymosin beta 4. And thymosin beta 4 is really imperative to tissue repair, to vascular flow, to helping to. So that's another one that when we exercise or we're injured, by using BPC and thymosin beta 4 together, we can markedly encourage recovery much more rapidly, either just from our workouts or after an injury. And then lastly, thymosin alpha 1, which is an immune modulating peptide made by the thymus gland, because if we can keep our immune systems healthy, everything else is going to work better as well. So those are kind of my go-to top of the line. There are lots of really cool peptides that help us with muscle building and just longevity. The mitochondrial peptides like MODA-C, humanin, SS31. These are just improving mitochondrial function, which is going to go a long way to everything from brain to heart to muscle. So I love the mitochondrial peptides as well. So we usually cycle through sort of a host of these in our patients. So we're going to be in terms of longevity, kind of keeping people on these cycles of some of these peptides, just to make sure that they're maintaining all the same ability to heal, recover, make muscle as we did when we were young.
Yeah, and another compound that's been getting a lot of attention, particularly in the longevity space as it pertains to autophagy, is spermidine. So I'd love to hear a little bit about your perspective on, what spermidine is and why is it important for anti-aging?
Yeah, spermidine is a kind of fascinating supplement. I actually started really gigging out on spermidine a few years ago, and it was not available in the U.S. at that time. It was funny. I remember calling to try and get this product out of Austria, and they weren't shipping in the US yet, and ultimately finally made it to the US. And it's a polyamine. So polyamines are really important. There's a whole pathway in our bodies that uses polyamines for cellular health and longevity. So when you look at spermidine, it's naturally found in some foods. So like wheat germ, peas. There's some foods that naturally have it, but diet alone, we don't get a whole lot. Some of the Mediterranean diets get a little bit more. People who have higher levels of spermidine seem to age better. They have less cognitive decline. They have better function. And that's really because it does exactly what you said. It activates autophagy. Remember, that's our cell cleaning mechanism, especially in muscle tissue. So remember, we need to get rid of bad cells in our muscle just as well. And interestingly, activating autophagy in muscle tissue seems to be very specific to spermidine. It's going to support mitochondrial function. So that's key. It actually causes some mitochondrial biogenesis. If I'm going to put on more muscle, if I'm going to have bigger brain, if I'm going to have a better heart, I need more mitochondrial function. And then because this polyamine flux pathway enhances muscle protein synthesis, it's useful to help maintain this muscle's endocrine function, or this myokine production. So, when we look at it from the longevity perspective, this autophagy, metabolic flexibility, better muscle quality, better brain function, and it's a supplement that I use regularly. And then if I really want to promote, I want to go through phases where I really want go heavy on autophagy, then I'll high dose it. I'll do that like 4 times a year. I'll high dose spermidine to really kind of clean everything up. But then on a daily basis, I take a lower dose just to help maintain my own levels. We know that levels decline with age. So you can try and eat it from aged cheeses and spermidine found in wheat germ supplements, but it's hard to get enough. And so that's where I think a supplement, a really good high quality supplement, is useful.
Great. Yeah. And looking to the future, what are some of the most exciting emerging therapies in, the longevity space, regenerative medicine space that healthcare providers should be paying attention to right now?
I think that there's a lot of cool things on the horizon, right? I think that when we look at what AI, as much as whether you hate AI or love AI is going to give us the capacity to do a lot more personalized medicine. especially as we see, quantum biology world excel. We're going to be able to sort of put people's entire genomes into a computer and say, okay, what is going to be really helpful for this person? So I think we're going to see the advent of really, truly personalized medicine. We've kind of gone down that road a little bit, but we really need high-level AI to be able to do that. And I think we're going to be able to do a whole lot more with that, right? Where we'll be able to really sort of really personalize things. But right now, I think that if we look at these targeted therapies or gene therapies, I don't think we're there with gene therapies yet. Honestly, I think that, like, if you want to do follistatin gene therapy, you're paying $25,000. It's going to last a year and a half. I'm not sure what undesired consequences still might be occurring with those, but I do think we'll see those develop to better levels. I think we are going to see gene therapies. I think we are going to see, I mean, really honestly, you look at compounds like MYOS, which is, to me, I'm going to do that much more than I'm going to go spend $25,000 on follistatin gene therapy, right? I think we're going to start seeing some of these advent of products that actually can epigenetically modify us a little bit, but they're not going to be so permanent as doing these gene therapies. And I think we're going to start seeing them very specific as we've learned more about myokines, right? These things that are produced by the muscles. And we keep finding these new exokines and myokines. We're going to actually be able to use targeted, like, exokine therapies. So if I have a person who can't exercise, for instance, because of an injury, I can do a very targeted therapy. So we'll see the development of some of these very targeted, specific, muscle peptides, for instance, that are going to be able to help me when people are having injuries. So I think there's a whole lot of cool stuff. And I think that's where, again, whether you love or hate AI, I think it's going to really be huge in our field to be able to really develop new techniques to really work specifically to people.
Yeah, I agree. All right, great. That was such a quick 30 minutes. So as we wrap up, we'd like to thank Dr. Elizabeth Yurth for her insights, as well as MYOS MD for sponsoring today's power panel. Fueled by the revolutionary proprietary ingredient Fortetropin, MYOS MD is trusted by healthcare providers nationwide to deliver real results backed by science. So again, if you'd like to learn more about MYOS MD, please go to our website, myosmd.com, to learn more from experts like Dr. Yurth and bring this powerful solution to your practice. So, Dr. Yurth, we're at the end of our time. How can listeners learn more about you?
You can follow me at Dr. Yurth. You can go to Bodo Longevity Institute or follow at Bodo Longevity. BodoLongevityInstitute.com if you want to learn more about our practice. We see people from all over the world. We're licensed in every state. So we can consult with people from all over the world if you're trying to recover from an injury or things like that. And if you really just want to get more education, we have an academy. If you go to bli.academy, we have a lot of learning tools, so you can learn more about peptides or things like that if you really want to sort of educate yourself a little bit more. So yeah, I'd love to hear from any of you guys, and if any input on new cool things that people are using, just hit me up on LinkedIn and let me know.
Amazing. Alrighty. Well, thank you so much and have a great rest of the week.
Yeah, I appreciate you.
Yes.
Bye.
Bye-bye.